I'm Mike Klag, and I'm Dean of the Johns Hopkins Bloomberg School of Public Health. Like everyone else, I remember where I was on 9/11/2001. I was the interim chair of the Department of Medicine, the School of Medicine, and I was meeting with the dean, Ed Miller, and he was called out of the meeting and came back and said a plane's hit the World Trade Center. Someone came in a few minutes later and said a second plane hit, and we walked out to the TV and we saw that devastation. We were on call for casualties from the Pentagon, which, as you know, had also been struck. And we waited all day. Nobody came. Nobody came because you either survived or you didn't. There was nothing in between. It was a sad day. In terms of how 9/11 has changed public health, clearly it focused us as a nation and as a field to external threats, to terrorist threats. It changed the focus of public health. It added a new focus. And so the whole issue about preparedness and how we coordinate response and work with first responders, how we educate communities, all that came as a result of 9/11. In public health, we like to deal with big problems. And so these are big problems, and we train people to interdigitate with first responders. We evaluate responses to disasters. We find better ways to respond in the future. So it's part of what we do in public health, but I hope we never have to do this again. A week ago, I was on a plane and I sat next to a man who was a stockbroker, hedge fund person, and we struck up a conversation. And he lived in Lower Manhattan. He saw the plane hit, and he just couldn't control himself during our conversation. You know, I think it's something that's burned into our consciousness and something that we'll always remember.